Hey, Joe.
How are you?
Over to you.
Okay, I'm going to make sure I unmute myself because I do that often enough. I'm going to press continue because that just pops up. Give me one moment. So good to meet everybody. Welcome to my living room or dining room. It's a really weird way to be meeting everyone as we all continue to encounter new ways of living in the COVID world. But again, thrilled that you're here today, thrilled that you're interested in learning more about our program. Little bit about me first. I in typical progression, did the associates in nursing, bachelor's in nursing, worked for a little while before entering Penn's program as a student myself and graduating from the program in 2012. About 2 years later, started teaching and have been track director for the past 2 years. So enjoy being part of the program, enjoyed it as a student and now in the faculty role, and excited to talk to you a little bit more about it. Names that you might see pop up if you engage with us outside of this webinar. I'm Joe Schatz. I have a DNP that I completed about 3-4 years ago, and currently work clinically in addition to teaching here in the program. So I work at an outpatient community practice and in a college health center, treating usually about anywhere from 75 to 100 patients a week. Dr. Sue Renz is the primary care programs director. So we had a restructuring about 2 years ago, and our psychiatric mental health nurse practitioner track now falls within the primary care program, which only serves to give us more access to expert guest lecturers and resources. So it's been a nice transition for us. And then when we talk a little bit later about clinical sites, you'll see Dr. Anita Iyengar's name pop up. She is a colleague and someone who works to expertly curate clinical experiences for students within our psychiatric mental health nurse practitioner cohorts. So here at Penn, let me move this because that is blocking my view. Our program faculty are all working clinically, and it's kind of exciting. We love what we do here at Penn. We love the teaching that we do. We also love treating patients and are able to bring that excitement and passion and real world case scenarios to you in the classroom. Through our coursework, which we'll talk about in a little bit, we strive to combine the academic excellence and research with real life application. So in a little bit, we're going to talk about our professional roles course, where as part of that, you in a small cohort will work on doing a true review of lit that will end up in a systemic review that could then potentially be published. And in the last couple of years, we've had students come up with PICO questions, come up with clinical questions from their clinical experiences, and really do excellent job calling the literature and finding the answers to those questions and presenting nationally and publishing. So part of what we do is help you to really understand how to use the literature in a real pragmatic way. So our faculty are leaders in the field, both the psychiatric nursing field and the larger nursing and healthcare fields. Researchers, published authors, and I really do think our biggest strength is our clinical expertise. So we have folks on our clinical, in our clinical teaching faculty who are currently inpatient psychiatric nurse practitioners, consultation liaison nurse practitioners who are working in general medical hospitals, sort of answering the doctor house questions about what's going on with this individual. We have folks who work in integrated primary care and are really pushing the clinical boundaries as far as providing population-based mental health care, and folks working in the community. One of the things about our program that you'll learn throughout this presentation is that we do prepare you to treat the population. So several years ago, other advanced practice psychiatric nursing credentials were retired, and the general credential is now the family psychiatric mental health nurse practitioner. So in our program, after completing and passing your board certification, you would be eligible to treat anybody across the lifespan. And in my caseload right now, I treat as young as 3 and as old as 107. And you'd be prepared to work in any setting. So inpatient, outpatient, community, lots of different roles. Here at Penn Nursing and in our track, we truly do believe in your success. And once you're in, we are 100% there for you. We look to individualize your experiences. We look to help you transition into the role of grad student and provide you the support that you need to be successful. All of our faculty are within the week accessible and have a 24-hour turnaround time for priority emails, and do a pretty good job of staying on top of that while working clinically and teaching. As part of the program, you'd be assigned a faculty advisor who you'd meet with at least twice a semester to review your plan of study, to review your clinical experiences, to review how your courses are going, and again, to ensure that you're taking full advantage of the experience of Penn Nursing. There are a ton of drop-in lectures available within the School of Nursing and within our partnerships with the School of Medicine and Social Work, and we do our best to get that information out to you. One of the other things that we are really good at, because it is so important to our program success, is maintaining relationship with our alumni. So very often, as students transition out, just this past year, after surviving COVID, which was an adventure, we had students who we were able to connect to our alumni networks in Virginia, in Oregon, in California, in Texas, and help folks, again, make those connections so that they can start to build their professional network in their home states or in the states that they're moving to for jobs. So we sort of get to know you during this process. And who are you guys? You guys are motivated adult learners coming from a variety of background. And one of the things that makes our program so rich is the broad experience that folks come with. So we have folks who come into the program as seasoned bedside psychiatric nurses. We've had folks in the last 5 years come in as certified nurse midwives who have worked delivering babies in the community and in hospitals, have recognized the importance of providing good psychiatric and mental health nursing care. ICU nurses who recognize the implications of psychiatric mental health concerns and see the consequences of poorly managed psychiatric mental health concerns and feel drawn to work with us. We have home health nurses and hospice nurses who really understand better than many some of the lived experiences that the folks that we support have. And one of the really nice things about our program is in our seminar courses, 705, 706, and 707, which we'll talk about later, we really have the opportunity to come together and synthesize not only the didactic lecture knowledge that we're building, but our own lived and professional experiences with our clinical experiences as psychiatric nurse practitioner interns. And some of the richest conversations we have come from those only semi-structured opportunities where we present cases to each other. So what are Psych NPs? Psychiatric mental health nurse practitioners focus on mental health promotion of individuals across the lifespan and emphasize quality relationships with patients, families, and communities. So if you all are here, you either have read about or have worked with psychiatric nurse practitioners and know that in clinical practice, psychiatric nurse practitioners are completing comprehensive psychiatric evaluation, engaging in ongoing psychotherapy, cognitive behavioral therapy, supportive psychotherapy, family therapy. Psychiatric nurse practitioners are engaging in psychiatric medication management and helping to treat conditions such as anxiety, depression, schizophrenia, bipolar. So our program certainly gives you the foundation you need to leave as a emerging nurse practitioner and practice competently and safely. We give you the foundation to be able to answer any clinical question that arises. There isn't a single week that goes by that I don't run into something new in my own clinical practice. And the foundation that Penn Nursing gave me allows me to go to the literature, to go to my clinical support network and answer the questions that I need answers to. Psych NPs provide extensive psychoeducations to patients and families that we support. We collaborate interdisciplinary to provide care. So there, again, isn't a day that goes by that I'm not having conversations with my colleagues in social work, counseling, psychology, with primary care physicians and medical specialists. So our program is either a full-time or a part-time program. The part-time option can take 2 to 4 years. The full-time option starts in May and ends at the end of June the following year. Even this year, just to speak to this for a moment, you all will not be surprised that COVID exceptionally disrupted our clinical opportunities. And with 25 students in clinical who were not able to be in clinical doing their 16 hours a week from about March until about May, we were still able to leverage our alumni support network and leverage our established exceptional preceptors to get folks out and done by the second week of August. So that was only a 6-week delay in the completion of the program. It felt in the moment like a bit of a miracle that it happened, but I say that because it does demonstrate how important it is to choose a school that has these strong community relationships and these strong community connections. Because I do unfortunately see the APNA listserv, for example, telling the story of folks who have completed 75% of their programs and are now stuck and unable to progress because they haven't been able to replace those clinical sites. So I think especially in COVID times, it's really important to be looking and asking questions about how clinical sites are found guaranteed and how those connections are made. There are some other specialized dual enrollment options, and if you have questions about those, it's because you've already researched those, though you can look more on the admissions website for those. We do have a strong encouraged recommendation that you have a year of clinical nursing experience before entering our program. There is not a mandatory 1-year requirement through the admissions process. What I will tell you is that folks who do allow for at least that 1 year of clinical experience have a much smoother transition into the program. It is very hard as a new nurse when you are already supposed to be learning how to time manage, how to prioritize, how to tell from 20 feet whether a person is sick or not sick, how to triage. It is very hard to learn how to do all of those things while you're also supposed to be learning how to practice at the advanced practice nursing level. This is something that, again, if you had specific questions about, I would encourage you to reach out. We can help you understand a little bit more about this rationale. But we see folks have a much smoother transition into the program when they allow for this year of experience. And the reality is, for the amount of money you're going to be spending on your Penn nursing graduate education, you want to make sure that your brain is in a place where you can be getting the most out of it. If you are anxious and stressed in that first year because you're learning how to do it all at once, you're never going to learn as much as you should. We know that from brain physiology. So I just throw that out there as some wisdom. Our program consists of 14 courses. It is a 14-month full-time program, as I stated earlier, so May to the following June. What I will tell you is that there are no electives, though there's certainly the opportunity to engage in some of our minors that we'll talk about in a bit. So the 6 core courses are pathophysiology, pharmacology, the role issues for nurse practitioners. So this is the professional issues course where you will work on developing your state of the science paper. And this is the paper that really does set the stage for you to be published by the end of the program. We have our advanced physical assessment course, research method and modalities, and our pathogenesis of mental illness and psychopharmacology. So here in this last course, we present to you both the DSM criteria, the neurobiology of how we understand disorders like generalized anxiety, bipolar, depression, schizophrenia to exist. And then we loop right in using both didactic psychopharmacology lectures and intensive clinical case studies. We start to treat those same patients by the end of that content period. So we used to have separate in the fall pathogenesis and mental illness course, and then in the spring a psychopharmacology course, but have found that this really helps to enhance your learning as the student because it helps you apply. It's not just learn this, understand it. It's learn this, understand it so that you can apply it. It makes it much more meaningful. And we all know that when things feel more meaningful, they are easier to learn, even neurotransmitters. Our 5 theory courses in the program are child and adolescent mental health, the mental health and aging at the bottom. Those are our two extremes of population. Reason I point those out is because the ANCC does require that whatever program you attend, certify your competence in treating individuals across the lifespan. So we give you the didactic content to certainly guarantee that you have the didactic knowledge. But again, Anita and I meet weekly and look over clinical logs and look to understand the exposure you're getting in your clinical settings so that we can then curate in subsequent semester experiences that truly allow you to leave prepared to competently and safely treat any individual, whether they're 3, 53, or 107. Our 3 psychotherapy courses are the cognitive behavioral therapy and the family systems theory courses. These 2 courses will help you build a foundation so that you can start to integrate both family systems theory and CBT into your clinical practice. And our middle course there, the clinical modalities course 625, is a survey course that exposes you each week during the 12-week course to 2 or 3 different clinical modalities. So you can sort of get a taste for each and understand, is Gestalt something that you want to learn more about after graduation? One thing, again, just because I think being transparent is important, no psychiatric mental health nurse practitioner program is going to prepare you to be an expert psychotherapist. And I think that's important for everyone to understand. So if you are envisioning for yourself a role where you are opening and putting a shingle out for a private psychotherapy practice, you do need to understand that you will need to do a lot of additional education and training after completion of the program. However, the foundation we give you will allow you to integrate cognitive behavioral therapy, family systems therapy work into your clinical assessments and into your clinical practice. I'd say probably about a quarter of our grads each year choose to go into a setting that allow them to not just prescribe medication, but maybe have a 30 to 45-minute session with a patient where, in addition to talking about meds and symptom control for 15 minutes, they're able to, with cognitive behavioral therapy, get into some real good work with challenging cognitive distortions, with working through thought journals and working through homework assignments that can really that lead to people having demonstrable improvements with their anxiety, their depression. Our cognitive behavioral therapy faculty for this course is actually someone who is on faculty at the Beck Center and brings his expertise. So throwing that out there. And then these courses are the courses that I'm course director for. That was courses a whole lot of times in about 10 seconds, sorry. 705, 706, 707 are the fall, spring, and summer clinical courses. So during these courses, you will be completing 16 hours a week of clinical for a total of 544 clinical hours in the program. These are the bread and butter courses, and I don't just say that because I'm course director. These are the courses where you get to really start to practice your advanced practice nursing thinking, your higher level nursing thinking. These are the courses that allow you to start to synthesize, again, the didactic knowledge you're developing with the clinical scenarios you're exposed to during those 16 hours a week, with your own lived and professional experience. And really work through, how do we conceptualize patients, and once they are well conceptualized, how do we effectively treat them? These courses are very heavy on clinical case studies, and we will very often break into live small groups, come to a consensus in that group of anywhere from 3 to 6 students, and then present out and allow some debate, so that these small groups can really talk about why their solution is the better solution, building a little bit of fun competition into the program. The reality in psychiatry, and if you all are here, it's because you already know there is no black and white, there is no right and wrong. If you're here for psychiatry, it's a world of gray. So these 3 courses allow you to work through really understanding in escalating complexity, what that gray is and how we navigate it. The physical assessment course, again, is a full semester summer course before clinical, right before you enter your first clinicals in fall, that allow you to really learn the physical assessment skills that you will need as a psychiatric nurse practitioner. The reality is, for many of us, we are the only advanced practice nurse that our patients might see in a given year. As few as depending on the data you look at, 40% of individuals with serious mental illness encounter any medical provider outside of psychiatry. So it's important that we have these skills so that we can assess, see what's normal, what's abnormal, and what needs further investigation, and then help empower our patients to follow through with that. Talked a little bit about our clinical experiences. What I will tell you is that, again, we do curate your clinical experience. So in the summer before you enter clinical, we will meet during an orientation, send out a survey, and get a sense of what you are looking for. Our priority will always be to ensure that you are prepared at the end of the program to be eligible to sit for the ANCC board certification. Very often, we can get you eligible while still meeting some of your clinical interests and clinical and professional interests. So we do take that into account. You do not have to find your own sites, and all of our preceptors are folks who we know and folks who we have relationships with. We have students placed in private outpatient practices, community mental health centers, consultation liaison services, partials and IOPs, geropsychiatric inpatient placements, subspecialty programs like eating disorders, and we have some rotational experiences through programs like ECT, TMS, have an emerging relationship with transplant, psychiatric evaluation, and co-occurring substance abuse facilities, in addition to federally qualified health centers for the exposure to integrated care, and the Veterans Affairs, multiple sites. There are minors available, and since Jenny has had to stay on up to this point, Jenny, can I mute myself so that you can talk a little bit about the oncology, and then I'll touch on the others?
Yes, as soon as I figured out how to unmute myself, that was wonderful. Well, thank you, Joe, and to Jamie for having me, and thank you as well to all of the students who came today to learn more about the opportunities here at Penn. So I'm a faculty member in the adult oncology specialty minor. And so one of the things that, we certainly always want potential students to think about is that when you come to a place like Penn, you're not, certainly you're coming for the stellar, population-based programs such as the psychiatric mental health program here, but you're also coming to kind of try to tap into what other services and levels of expertise are available in really large academic centers like University of Pennsylvania. And so here at the School of Nursing, we've really tried to leverage a lot of those other areas that are available throughout the university and tried to bring them to students so they might be able to take advantage of this coursework and add some breadth as well as some depth into some specialty areas. And so an example is the oncology minor. So the oncology minor, certainly you could think about taking a minor such as the oncology minor, because maybe you think about you want to specialize in providing mental health services for individuals who are receiving cancer-directed therapy. So maybe part of like, the Abramson Cancer Center or something like that. Or maybe you want to take the oncology minor because you recognize that, unfortunately, many individuals that you're going to be seeing in your general practices are going to either have risk factors for cancer, or they're actually going undergo cancer treatment, or they're survivors of cancer. And you want to better understand what that experience might be. So the oncology minor can certainly be done for those who think of themselves as a specialist in oncology, as well as someone who is really taking this information and applying it to more of a generalist practice. The one thing that I want to be very clear is that we are not changing your scope of practice. Your scope of practice would be that of a psychiatric mental health nurse practitioner. you would not necessarily be taking this coursework and all of a sudden be prescribing chemotherapy and managing, intractable nausea and vomiting and brain metastasis and things like that. But it really would be that you would be able to partner with the patients and with their oncology teams to really help best manage, the psychiatric comorbidity that many of our cancer patients have, either pre-existing or as triggered by cancer. The oncology minor would be 3 courses. And we were very fortunate about 9 or 10 years ago, even pre-COVID, that we were able to take our minor and actually redesign it so that it is presented in a hybrid format. So that means that students can, and many of the minors are even pre-COVID, were already starting to do this to make them more accessible. So you might come on campus for like 2 days a month, or 2 days a semester, like in the fall and the spring, which is the case for the oncology minor. And all the other content is delivered online, either synchronously through webinars and things like that, or asynchronously through modules of videos and homework assignments, case studies, presentations, a variety of asynchronous methods. We do require clinical. We are, as far as I know, the only minor that does require clinical. But we really have been really fortunate to partner with our colleagues in the population-based program, including the women's health program. And most of the time, we're able to craft clinical placements that would be in an oncology center, maybe in a counseling center, like in the Abramson Cancer Center or in other counseling centers. And those clinical hours would meet the requirements for us, as well as the requirements for your population-based program. But that would be something that we would have to very carefully craft with yourselves, as well as with your faculty, as well as with our clinical placement clinical faculty member. So again, I don't really want to take up more of your time. I know you didn't come here specifically to hear about the oncology minor, but again, I just think about encouraging, when you think about coming to a place like Penn, you're looking at other ways that you can dive into the level of expertise that is available in such a large clinical practice. Joe, I'm glad to stay on, and if afterwards, try to answer questions about minors in general and oncology in specific. But thank you for having me today. And again, I do wish your candidates, good luck as they pursue all their options and their application process here.
Awesome. Thank you. And again, even if you're not interested in the oncology program, what you'll pay attention to is the excitement and the enthusiasm and the passion, because again, regardless of what specialty program you're looking at, regardless of what courses outside of the psych courses you're having to take, everybody's really excited to be doing the teaching. In our program, just to run through this quickly, students I have seen in the last 5 years do the autism spectrum disorders program, the global health program, the oncology program, the palliative care program, and the women's health program. I haven't seen students in the last 5 years do any of the second half of that list, but they are also certainly options. And there we go. Upon graduation, you are eligible to sit for the PMHNP certification through the American Nurse Credentialing Center. And would then from there be eligible for state certification as advanced practice nurse. Sort of the same idea. You have to take the NCLEX before you get the RN. So what makes Penn students so special? Our students are published. Our students have the opportunity published and are strongly encouraged to do so. This past summer, we actually, for the first time, made it the strong encouragement as opposed to the requirement, because there was enough stress with COVID. But at the very least, you will leave the program having had to, with your small group, put your state of the science paper into a journal's publication format, so that if you choose to publish, you can. And there's nothing wrong with walking into your first job interview with a publication on your CV. Our students, again, take the knowledge and expertise that they hone at Penn and present nationally. And again, lots of opportunities to learn from a lot of wonderful preceptors that we get you access to, and from a lot of really excellent faculty in our theory-based courses. people come to Penn. So when something's being announced, when something's being released, when something big is happening, it often happens in our auditorium, and it's nice to be exposed to that right from the beginning. And again, so far for our cohort last year, hearing 100% pass rate, and that 100% is pretty typical for our cohorts each year. We are one of the oldest and most established psych NP programs in the country. We continue to emphasize psychotherapy alongside the psychopharmacology in our program. And we do have a lot of experience preparing competent, safe, effective, and exceptional nurse practitioners. Just want to blow through some of these because I want to make sure we have time for questions. What I will tell you is when you have options. As a nurse practitioner student, you have options. The one thing I will tell you in our area is where you go to school can matter. Where you choose to get this PMHNP degree can matter. We are nowhere near being saturated with PMHNPs. There is still an exceptional demand in almost every geographic location. I can only think of one state off the top of my head that is approaching saturation. That being said, there are more and more PMHNP programs popping up, and some of them are programs that when they pop up on a pile of CVs, they go to the bottom of the pile. Our program, because of our alumni network and because of our far reach, because folks move here for the program, then move back home, regardless of where you're coming from, our program does have a really good reputation. And that does mean something when you're negotiating for that first salary, for that fifth salary, for that salary 10 years in. People will notice you and push you towards the top of the list. And we hear that feedback from our grads consistently. And again, part of it is the connection to the UPenn name. You will, throughout your alumni connection, have access to our career services and to our faculty network. So yeah, I think that's where I'll stop. So let me end here because I do want to make sure we have time for questions. Did I stop that?
Joe, I just want to quickly go over the application deadlines before we take questions, since I know that will be a big question.
Okay.
And of course, I also want to thank you and Jenny for wonderful presentation. If anyone has wants to learn more about the adult oncology program, of course, Jenny's available for questions. But there is a recording of a previous webinar available, and you'll get that emailed to you with this recording. So let me just go over the application deadlines. If you're applying to the accelerated BSN program or BSN MSN, that deadline is quickly approaching. Can't believe October is this week. So that deadline is October 15th. So that's if you are not currently a nurse, but want to be one and potentially a nurse practitioner. That follows a traditional admissions process. So all applicants will be notified in mid-February of their decision. As Joe mentioned, you can do the program full-time or part-time. If you are interested in enrolling for part-time for this spring, the deadline's also October 15th. If you are interested in enrolling for full-time, so where you start in May and finish the following June, that deadline is November 2nd. And if you're interested in enrolling part-time, but not starting for this summer until the summer or fall, you have until March 15th, 2021. If anyone listening is a current Penn BSN or ABSN student interested in submatriculation, if you're a senior, you'll need to apply by November 2nd. If you're an ABSN student or a junior, you'll apply by April 1st. On the right-hand side is the latest notification that you'll hear back from. So while we have one deadline, we have a rolling notification process. So you might have a colleague or a friend who's also applying. You might not hear back for a month and your friend might hear back in 2 weeks. So don't panic. We receive a lot of applications and it takes a while to get through them. But you will hear back latest by these times. And also just to plug our other upcoming webinars, we understand you might be interested in other programs or want a basic overview of the accelerated program or go into more details about the admissions process. We do have some webinars coming up. And again, they will be recorded. So if you can't make them, you can always watch the recording. All right, and now let's get into Q&A. So if you just want to type in the chat box, we will answer them.
This is where it starts moving fast. So the PMHNP track is available for accelerated BSN students, but again, our program recommendation when you meet with us as your faculty advisors would be that you take that opportunity to work for at least a year after completion of the ABSN before starting the MSN. There's a word for that. What is the word for that? Is it deferring the start that you guys call that downstairs, Jamie?
Yeah, so if you apply to the BSN MSN program at the same time, you'll have a spot available upon graduation from the BSN program, and you have up to 5 years to complete, or from graduation, you have to complete your MSN degree within 5 years. So you can go out and work for potentially 3 or 4 years if you do the program full time before coming back.
Cohort size this year is 22. Last year was 25. We have not exceeded 30. There is no active plan to turn the entry-level PMHNP into a DNP at Penn Nursing at this point.
I do want to plug that we do have a postmaster's DNP program, and we have a brand new executive leadership DNP program. You would be eligible for the postmaster's DNP after completing our MSN program.
And Jamie, I'll let you look at Belinda's question. Eileen, while Jamie's looking at that, say that no, and there's some disagreement depending on who you talk to, but I think really what's important, if you know you want to help support individuals who have concerns with mental health, it doesn't matter to me where you work and get that nursing experience, because what you're learning in that first year is, again, how to time manage, how to prioritize, how to triage, how to assess from 20 feet who needs help right now and who can wait 20 minutes for help. And I think you can learn that as a nurse in any setting.
Yeah, I also, before I answer Belinda's question, I just want to piggyback off that while reading applications. Mental health is everywhere. So we certainly have a lot of applicants who come from psych units and mental health units, but we also have applicants coming from ICU and critical care and the emergency department and primary care. So I agree, there's not one specific kind of work experience I might be looking for. To answer Belinda's question, so it said the admissions page says the GPA was for a cumulative BSN GPA, which would not be recalculated. That means applicants currently completing their BSN are required to take the GRE regardless of current GPA. So no, so if you are currently in your BSN program and you have at least a 3.2 GPA or higher, you do not need to take the GRE. What we mean by recalculated is that if you took extra classes, or your nursing GPA is higher, but your overall GPA is below 3.2, that's what we mean. We don't recalculate that GPA. So whatever it says on your transcript, either right now or at time of application, is what we use to determine the GRE waiver.
Question here about inpatient clinical experiences. Yes, we certainly use many inpatient facilities. We do try to make sure that everyone gets exposure to community-based placements, and many of our students are also able to get inpatient-based experiences, but not all of our students. That clinical course, one of the things that allows is for us all to learn from each other in our different clinical settings. So again, while you may not be able to work as an intern in every single clinical specialty area that we offer, you will be able to translate your skills into that setting upon graduation because of the way we structure the program. The full-time start is for summer, May only.
I can answer the question from Zarama. Currently an ABSN student, I graduate in November and still have to take my NCLEX. Would I still be able to apply, or do I need my license before applying? You don't need your license to apply. You do need it to start the program. So as long as you'd have it by the time you start, you could enroll.
So when are classes offered? So any number of the days of the week. The 705, 706, 707 are always Tuesday, 9 a.m. And in the fall semester, there is a Tuesday psychopharm class after that and a professional issues course on Wednesdays. The big core courses like pathophys are long all-day courses, so all over the place. There's no consistent schedule semester to semester. Clinical at this point is, so does clinical have to be done in state? In non-COVID times, we use clinical sites in Pennsylvania, New Jersey, and Delaware. One of the program requirements after you're admitted, after you've had your orientation with us, would be for you to secure nursing licenses in all 3 of those states. Doesn't mean that you're necessarily going to work as students in all 3 of those states, but it gives us the flexibility to move you at the last minute should there become an issue with a preceptor getting sick, for example. And we do have clinical sites established in all 3 of those states. During COVID, there were, as we helped folks move back home because their leases were expiring in Philly, there were a handful of opportunities, but those were on an exception basis at this point, because our strong hope moving forward is that we will return to a mostly on-campus in Philadelphia experience. Scope of practice is absolutely not limited. So the question here is, can you check thyroids or basic labs? I would say there's an obligation based on clinical practice guidelines to check baseline labs and understand where liver function is, where kidney function is, and to be able to make appropriate referral decisions based on the labs that you order. If someone has that history of progressively worsening depression associated with weight gain, associated with physical signs of a hypothyroid presentation, absolutely a TSH is something that we would be ordering and interpreting, among
Joe,
many other labs.
There was a question I just want to make sure from Vivian. I'm not sure if you know the best answer. For BSN students who are considering sub-matriculation, is there a graduate level course you recommend completing first?
So I am speaking to you as not the strongest student in the history of Penn graduate nursing. I can promise you that. I would get your pathophysiology 607 and the general advanced pharmacology out of the way, because those are 2 heavy courses. And if you can do those on their own without having to worry about psychopharmacology at the same time, you're wise. What does a typical week look like in the full-time program? Anywhere between 4 and 5 classes plus the 16 hours. So it truly is full-time. Jamise.
I can answer this next question. For the GRE waiver, do I need to use my associate's degree GPA or just my BSN GPA? So it is just your BSN GPA that we use to calculate the GRE waiver. And that is if you have a 3.2 GPA or higher on a 4.0 scale, it is waived. Or if you have a previous master's degree with a 3.0 GPA or higher.
Question here, if you apply full-time and are admitted, are you able to switch to part-time or vice versa? I would strongly encourage you, because I, again, work with Anita and with admissions to, again, curate our clinical cohorts to make sure that we have a good mix of full-time and part-time students, because often folks come in with different experiences. Folks come in with we like to make sure we have a good mix. So if you think you might be transitioning to part-time, I would just apply part-time. Additional education, Joe mentioned additional education would be recommended if you were interested in psychotherapy. What type of program would that be? So for example, that would be like completing a residency through the Beck Center in Philadelphia if you were interested in CBT. So it'd be additional didactic and clinical supervision as well. It's not just learning the knowledge, it's through the clinical supervision process, refining and your use of the knowledge. What if one currently has completed an MSN program but is seeking to function as a PMHNP? Should one consider the Postmaster's DNP program? So right now at Penn, the Postmaster's DNP is not a program that is expanding your scope of practice. So you would still need to do a PMHNP program. So here at Penn, that would likely mean doing a second master's degree. Question, how long is the program? 14 months full-time, 2 to 4 years part-time. And the DNP is how many on top of that, Jamie?
It's 2 years part-time, and the DNP is completely online.
Kat had a oh, I'm sorry.
I did see a question up top about tuition. We have the same tuition costs for in-state and out-of-state students, and that exact number is on our website.
Kat had a follow-up question about the psychotherapy. So again, you would want to anticipate that you would enter a first job as a psychiatric mental health nurse practitioner just to start getting that experience. And while you're doing that, you would attend one of the therapy schools to really build up your expertise. Question about our transition to online education during COVID-19. So we did that over spring 2020 and did a pretty seamless transition, just moved our content online. And the university for the fall semester is continuing to be an online program. To be totally honest with you, I was a little bit apprehensive and nervous, but the faculty have done an exceptional job, and I am enjoying online education as much as I have enjoyed in classroom education in the past. So I think everybody's resilience has been tested, and I think everybody has come out on the other side happy with how things are going.
Joe, I'll just add to that, since in our program we have been doing online or hybrid education for a number of years. We really do need to acknowledge the fact that the School of Nursing, probably about 4 or 5 years ago, heavily invested in an instructional technology department here within the School of Nursing. And they have been really incredible resources, and really not just helping us actually do it physically, but also to make sure that we are providing an online instruction that's consistent with learning theory, that really promotes engagement, that is polished. And so, you know, so I do think that we really do need to acknowledge the fact that we really do have an instructional technology department embedded in the School of Nursing, which has helped us in this mission.
Okay, thank you. We don't have many students, Kat, go right into private practice. Most people choose to work in an inpatient or a community setting where they can really have exposure to a support system in that first year of practice and really start to feel confident with their day-to-day skills, because just like the transition into the RN level nursing, the transition into advanced practice nursing does take some time to build up that confidence. I will say that while we have certainly learned a whole lot about new novel ways to teach, and we're going to be holding on to some of those, our goal at this point is going to be to transition back into a predominantly classroom experience as soon as COVID allows. So while there will be hybrid components with courses, historically our courses have not been hybrid, and our predominant focus for the graduate PMHNP will go back to the classroom. I'm just reading over some of that. More questions.
I can answer a question that looks like it got asked to me privately, but I think it's a good question, so I'll answer for everyone. It's how can I set myself apart from other applicants? The psych mental health program is probably one of our most popular programs. As you can see, we had almost 100 people on this webinar, which is fantastic. So we receive a lot of applications. And I would say the people who are the strongest are really able to emphasize why they're interested in becoming a nurse practitioner, becoming an advanced practice nurse, and what is it about the population, or so what is it about working with psychiatric mental health patients, and really describing their goals and their hopes for becoming an advanced practice nurse. You don't need to know exactly what you want to do after graduation or have a 10-year plan, but you should be really thinking hard about what you want to do with this degree and with this program, and who you want to work with and work for. And I would say another important point is the recommendations. So getting really quality recommendations. They don't have to be from deans and CEOs and CNOs, but from people who really know you well and can really speak to all of the wonderful abilities that would make you a fantastic nurse practitioner. So your leadership, your time management, your ability to work with diverse populations, everything that would make you a great nurse practitioner is what would be emphasized in your recommendation letter.
Unmute. There we go. A lot more questions about the psychotherapy training after the program. That is something I would encourage you to take a look. REBT, Ellisonian REBT has a school in family therapy schools. There are CBT schools, psychoanalytic schools. So that's something I would look at on your own as you start to do your career planning. No, you can't do clinical in any state. Again, once we transition back to predominantly online, our plan would be to continue to use the tri-state area, so Philadelphia, New Jersey, and Delaware. Most of our students do not go into fellowship programs afterwards, though several do each year. Students that want to sort of build some more structure and support around themselves as they transition into practice. That's something that certainly when we get invitations to apply, we share with you, but that's not with our students, but that is not something that we would help you find.
For the question about the health leadership and global health minors, all of our minors, a sample curriculum and courses that will count towards the minors are available online. So you can get an idea of what courses you would need to take. They don't lead to any certification, unlike some of our other minors. They're really just designed to increase your knowledge in these areas. So the health leadership minor can be particularly helpful if you're interested in administration or advancing in a leadership position. And we have a great global health area at Penn Nursing and a department of global health. And in non-pandemic years, you'd have lots of options to travel abroad or interact with international organizations. So this would be a good way in these times to increase your knowledge of global health and global nursing.
I'll also just add that the application to the minors are usually done after your decision has been made regarding acceptance to the population-based program. So that's something that is worked on at that time period, not during your initial application.
Mm-hmm. We do have a question on the application asking if you're interested in a minor, and that's just to gauge interest. It's not binding. And most people wind up declaring a minor once, as Jenny said, after admission.
So I wish we knew when we were going back to classroom teaching. We don't know yet. I'm excited to hear that answer, but I don't think any of us know anything right now. This is just where we're living. Part-time program has a fall or spring start. So you would, it's, again, that's the rolling admission, and you'd be, that's how that works, Jamie?
Yes. So you can do part-time spring, summer, or fall. And if you are invited to an interview, which usually happens with Anita, she would discuss a plan of study based on how long you want to do the program.
One other question, opposite. What if someone starts part-time and they want to transition into full-time? That is not something that typically happens easily, because again, we really do, we have a cohort planned for 2022, 2023 already. It's not a full cohort, but we know that we have some part-timers who are going to be entering the clinical sequence at that point. So we are not super flexible with being able to switch from part-time to full-time. And we are a little more, but still not terribly flexible with the switch from full-time to part-time. That's just all the moving pieces in the background. Interviews are required.
I do see some questions about prerequisites. So if you are a current nurse or you're currently in a BSN program, the only academic prerequisite is an introductory statistics class. If you are not a nurse and applying to our accelerated BSN program, there are a lot of prerequisites off the top of my head, but they're on our website. And I do see someone asking, they're taking A&P and micro online, and we can accept online prerequisites. And even during a non-pandemic year, we do accept online prerequisites.
I appreciate that last question, because I don't know the answer to this. Any guidance on, with pass fails, how that's going to be taken into account, Jamie? Not to put you on the spot on that one. I'm just curious myself.
Sure. So we will accept pass fail for this year, and as long as the pandemic continues. But we are taking it semester by semester, as we are with everything else.
Holistic nursing is holistic. So holistic nursing is certainly incorporated into the program, but specifically things like complementary and alternative medicine, again, touched on, but you will not leave the program an expert in any specific CAM.
For the question about the resumes, there is no page limit for your resume. I would say most applicants submit between a 1 or 2 page resume. So we are a little over an hour here, and I want to be respectful of everyone's time. So we'll start to wrap up. If you have any additional questions, you can just send an email to the admissions office, and I'll type our email in here. It's admissions@nursing.upenn.edu. I know Joe and Jenny are also happy to answer program-specific questions, but if you have any general admissions questions, please feel free to send it to us. Thank you, everyone, for attending. Thank you, Joe and Jenny, for your time. If you are applying this year, good luck with your application, and we look forward to reading them. Have a wonderful day, everyone.
Thank you, Jamie. Thank you, Jenny.
Thank you, everyone. Good luck.